Lambusie. We're joined by Dr. David Twum Gyamara. He's a life support Ghana instructor, very, very helpful, useful in this conversation. Professor Ahmed Nuhu Zakaria is the Chief Executive Officer of the National Ambulance Service, one of our most important first responders. Kwame Sapon-Asiedu is a pharmacist, a D&D fellow at CDD Ghana. His medical expertise has helped shape lots of conversations and policies in Ghana. Gentlemen, good morning to all of you.
Good morning. Good morning.
Thank you very much.
Good morning, everybody.
It's great to have you, Kwame. I suspect that the voice we heard on the phone was Dr. Twum Gyamara. Is that right?
Yes. That's
fantastic. Me. Doc, if you don't mind, I'm going to start with you because the most recent issue that reignited this conversation following last week's submissions by Professor Bayo and the Isikado MP in Parliament, the most recent event was the death of this Kotoko supporter. Now, those who were there and those who have had the opportunity to watch the video observe that the things that could have had a chance of saving this person, none of them were done because nobody on the scene seemed to know what to do. How have we come to this point where, as a nation, there is such widespread ignorance of first aid and, in fact, basic life support?
That is very, very true. I would say this, that just as you put it, and just as Prof also put it right, in the case of an emergency, your best bet is your first responder. And unfortunately, what we saw in the video, and the police, the ambulance that was there, the people, the standby people, they didn't know what to do. And if any of them knew what to do, or was even knowledgeable in a little first aid, it could have saved the gentleman. But like how you put it rightly, nobody knew what to do, and unfortunately, we have this situation on our hands.
Now, I wonder where we should be looking for leadership in solving this problem. Other parts of the world seem to have figured it out. I'll give the example of the UK. It's the example I have seen for myself. Every public place, there is a defibrillator with clear instructions on how to use it. Not just that, but the law has ensured that every place where the public have access, there is a person or persons trained in first aid. They have also ensured through public education that in every home, basic first aid is known. So at any given time, every British citizen is within reach of a first aid trained person. Prof. Zakaria, there are many who feel that this is a role that the ambulance service ought to be taking up. Do you agree?
Yes, Mr. Youngson. Before I come in, good morning to your colleagues and all the Cherish with listeners. I want to have this discussion from three perspectives. Number one, we have to look at the concept of what constitutes a well-developed pre-hospital emergency response system. We have to look at the essential components of a well-developed pre-hospital emergency response system. And thirdly, we need to make a comparison of Ghana's pre-hospital emergency response system with an ideal system. We'll look at the gaps and then make some recommendations so that as a country, we move our emergency response system forward. If I'm permitted, can I start, sir?
Yes, very briefly, because we'll come to the meat of it later. But yes, a quick summary.
Yeah. So basically, like I've said, Ghana, actually, if you remember, since 2004, we have tried to build an emergency medical services through the National Ambulance Service, albeit with a lot of challenges. And I'm really excited we are having discussions. And I'm happy that today we're able to look at it holistically, and then we can draw a roadmap and see how, as a country, we'll be able to develop the system. But first of all, the question anybody will ask is, what constitutes a well-developed pre-hostilities response system? And the answer is very simple. It is normally a coordinated network of trained personnel, here empathy personnel, medical resources, and communication infrastructure designed to provide timely, efficient, and high-quality medical care to patients before they reach a healthcare facility. What does the system do? It ensures rapid response, appropriate intervention, and seamless integration with hospital-based care to improve patient health. And this reduces mortality and morbidity. Normally, if you look at that system, it will include emergency call dispatch service. It also includes equipped ambulance, trained personnel. Then you also look at the other component, which is real-time communication. Then the
Prof. Zakaria, forgive my interruption, but I think we need to reposition you, or perhaps redial your number to get a cleaner line, because we're missing every other word you say. Forgive me. We do want to know what the issue that you are raising. So please bear with us. We're just going to redial you and see if we can get a better line. Now, just before we take a break, Kwame Sapon-Asiedu, when we heard Prof. Bayo's earlier submission, one thing he made quite clear was that part of this problem will include updating our laws. The most relevant law when it comes to ensuring that there are trained first responders and health and safety, people everywhere we go. The most relevant law was written in 1970, and it only says there should be a first aid box and a first aider. What that first aider should be capable of and how he should be assessed or be made into a first aider, none of that is clear in the law. Is that it? Is that really or is that perhaps step one, that we need to make better laws?
Well, yes, Kojo, thanks, and good morning to everyone again. I mean, the first point, if you listened to Prof. Bayo's speech, which I've had the opportunity of reading, you would realize that there are a number of things he points out that even the trained first responders, like the ambulance technicians, paramedics, and other things, are not regulated. In any health system, all the health professionals are regulated. Like Prof. Bayo said, he has to do continuous professional development and other things to be recertified every year. I have to do the same thing here. In Ghana, a pharmacist has to do it, a nurse has to do it. Why not the paramedic, the first person who would determine whether you make it back into life or out of life? But when you say that, well, they have to be regulated, how do you set a framework for them to be regulated? If you listen to Prof. Bayo's introduction again, he makes the point that they said organizations should have a first aid box or a first aid kit. Even what it contains, nobody knows. If you look at even our vehicles, they say vehicles should have first aid kits. Everyone can go to the mall and buy a first aid kit. Do we have standards as to what that first aid kit should contain? All these things would have to be enshrined in laws and regulations, because in the countries that have got it right, these things are spelled out in no uncertain terms. What should be in a pub, what should be in a public place, what should be in a bus stop, they are spelled out in no uncertain terms. Even the requirements, the standard operating procedures for, say, the paramedic or the ambulance driver is spelled out. If this was done, so for example, this ambulance driver, you're all saying was negligent. Do you know his terms of reference? What if his terms of reference said that he could lock the ambulance and watch the game as well, because he's also a first aider, and probably if someone got injured on the pitch, he would be needed? We do not know. All these things. So for you to actually hold that person accountable for any misgivings or negligence, there would have to be some laws, or there will have to be some regulations, or there will have to be guidance. So yes, I agree with Prof. Bayo that that is the starting point. Without the law, which is the legal framework, you cannot have the other things, which are the guidance, which are best practice, standard operating procedure, regulations. Those all emanate from the law. And if the law we have is 1970 and it doesn't even tell us what's in your first aid box, if even a factory inspector or building inspector or work inspector came, all you can ask is, do you have a first aid box? You show him the box, whether it's empty or not. He cannot do anything technically because the law says have a first aid box. It doesn't specify what needs to be in that first aid box. And that is why I agree with Prof. Bayo that the starting point is to get the legal framework right.
And before the break, we were talking to Prof. Ahmed Nuhu Zakaria. Prof. Zakaria, just before you go back into your explanation of the components of a proper pre-hospital emergency service, let's put this matter to bed about what happened at Ishachire. So we've seen the videos. People calling for the driver of the ambulance who wasn't there. You must have looked into this. What happened, and how can you educate us on what these ambulance staff were supposed to have done in such a situation?
Okay, Mr. Youngson, thank you very much. The story wasn't complete because, as a country, people are very quick to sensationalize events. Normally when there's a social event, there's what we call medical cover. And so when the paramedics or the crew arrive, they will be in touch with the coordinators, and then they will tell them what to do. But for sporting events like this, they will be in the stadium in case there are any casualties, then to attend to them. So if you follow the story, what happened was that when the riot ensued, about 4 people sustained multiple injuries. And so these EMTs had to move in to attend to them. So while we were attending to them, that was when the stabbing incident took place. And this happened outside the stadium. So the protocol supporter had to be carried towards the ambulance. So they arrived at the time when this EMT crew were still attending to the casualties. So it was after when the attention was on to this other casualty, then they had to come back, some of them to attend to him. So if you follow, it was the EMTs who attended to the casualty and carried him to the hospital. And then the patient or the casualty died eventually in the hospital, but not in the stadium.
Right.
So that is exactly what happened. It's like they locked the ambulance.
So, Prof, help us understand. In such an instance, at such an event, is the EMT, the emergency medical team, supposed to leave the ambulance unattended?
No, what I'm saying, ideally, when there are casualties, obviously they will go and attend to the casualty and bring the patient to the ambulance. They don't stay at one piece in the ambulance. But if you follow this story, it was an abnormal situation where there was already a lot of casualties within a very short period of time. So if you observe, definitely they have to quickly go and attend to the patient. But Mr. Youngson, you see, there are 7 essential components of a well-developed pre-hospital emergency.
Forgive me, Prof. We will get to that in a minute, but let's just help us understand and clarify the situation well. So there were emergencies occurring inside the stadium, and the
Absolutely.
EMT were attending to those.
The 4 casualties.
But what about the driver?
No, the driver is part of the crew.
Say that again.
Let me explain. The crew comprises of 3, and all of them are trained emergency medical technicians. The driver himself is also an EMT. So normally, all of them will attend to the patient and bring the patient to the ambulance to the hospital. So it's not a situation where there's a driver sitting down waiting for the others to come. No, they're all EMTs. Now, in situations where you don't have such accidents, then one person can remain in the vehicle, then the 2 will then bring the casualty. But if they have multiple casualties, definitely his services will be needed. And so he has to go and provide extra hands. And here they had 4 casualties at the same time. I hope you get me. And so that is why at the time the casualty got to the ambulance, there was nobody. But eventually, they came and attended to him, and then they moved him to the hospital.
Yes,
so it's not like they locked the ambulance and they disappeared. But the reason I want us to really put this discussion in perspective is that because we have 7 essential components of a well-developed pre-hospital emergency response system, if you don't discuss the 7 together and you look at them in a disjointed manner, we'll miss the point and will not be able to really help to improve it. So if you allow me, we'll go through all the components and you'll see where the national ambulance comes in. And therefore, if we are able to improve the other components, situations like this will be good. So the first component normally is to develop an efficient, responsive emergency system. There's this efficient communication and dispatch system. What falls under this? Under this, a universal emergency number. You have a single, easy to remember national emergency contact number. In this case, Ghana, we've tried to establish the 112, but there are challenges that we can discuss later. Now, you need 7 emergency call centers, and by trained dispatch assess cases and coordinate responses. Obviously, we have dispatch centers. We have 24 emergency call centers. The challenges we can discuss. We also have what we call a computer-aided dispatch, technology-driven system for tracking ambulances and optimizing response time. And then we have what we call multi-agency coordination, where you have seamless collaboration between the emergency services, the police, the fire services, and the hospitals. Now, component 2, then we'll talk about rapid response and well-equipped ambulance network. Here you are talking about strategic ambulance placement. And based on the geographical data, the number of ambulances that the country should have, I'll be discussing the ratio Ghana has. Because the international standard is 1 to 50,000. Ghana, we are doing 1 to 200,000. We'll go into those details. Now, if we look at others, you have what we call effective traffic management, where we have legal priority for emergency vehicles during delays. The third component, which we are discussing, highly trained emergency personnel. And it's not
Prof, I think we have to get you into a new position.
Even lay persons, all these people are trained with first aid and CPR. If you have a system like this, it means that beyond the EMTs, all these other people will have the network of practice. Then we have
I'm so sorry. The line is not good enough, and so we're missing a lot of the important information you're sharing with us. Let's see if we can work on that. But here in the studio, the other professor, Titus Bayo, is here, and of course, every other guest has referred to your introduction, where you really laid out a lot of these issues. Prof. Zakaria is expanding on it and suggesting that look, there are 7 components which he's seeking to educate us on, and we'll get to that. But look, this was all sparked by the events at this football game. What we didn't hear was their standard operating procedure in terms of the capacity. So how many ambulances should be at a game with thousands of spectators, for example? Now, what are you hoping? Because I know that you are focused on solving this problem from the legislative point of view. What are you hoping that a law would say about that component of pre-hospital emergency care?
All right, thank you. So I think just to take over from where Prof was heading before I go to that, I think he was just about talking about the fact that you also need the general public to be very knowledgeable so that the first responder becomes your first aider.
Right.
So that person, those who were there and just screaming, where's the ambulance, all of that, in that particular scenario, somebody could start some CPR. If the guy was becoming unresponsive, somebody could have raised his feet to bring blood towards the chest and sustain this guy for a longer period. I mean, that kind of public knowledge, I think, is low. But the real objective is that we need, everything starts from the law. So we need a legal framework that is in sync with current best practice, and we are not operating in vacuum. This has been practiced elsewhere in the world, so we just have to look at what is there and what can apply to us. So I am hoping that we'll review the laws such that the emergency pre-hospital emergency care become well regulated. And standard operating procedures from this law then should be made public, and then the public can help monitor the implementation of the law. So if I call a fire service, I should get an assurance from the fire service that from your house, if you call us, we are expecting that the tender can get to your house in 20 minutes. So that if that doesn't happen, I can hold them responsible. And I think that's what is done in other places. So in the event of medical emergencies, we should have a law that defines the roles of everybody. So where should we put an AED, a defibrillator, for example? High traffic areas that must mandatorily have defibrillators. Can we have defibrillators customized to speak Ghanaian languages? And they can. That will instruct you. The person is not able to do ABC, position this way, position that way, in Twi, in Ga, or some other languages, and then the instruction on how to use it. Then the certification of people. If you look at what happens in the transport sector, I read a publication where someone did a study on Medina, the transport terminal there, and you see that people have the first aid box. They don't even know its use. They don't know what is supposed to be in it. When the police has, they just show it to them. Some are virtually empty. Some have expired plasters and things in it, and that can do nothing. But the critical thing is that driver and his mate or whoever, when they are going to renew their license, is there any requirement of law that they show evidence that they have had some basic life support training? Is there any form of certification that they are carrying 30 people on the road? If someone should go unconscious, even the car is not involved in an accident, but someone is unconscious in the vehicle, can they lead the process? If you are a manager of a public building, what does the law say? So I'm expecting a law that mandates managers of facilities to have regular simulation exercises. So should there be somebody from the municipal district assembly that comes to Joy FM or multimedia and find out when was the last drill? Where is the certification? How long will it take to evacuate every single person from this building? I was in a hospital in the US where the alarm went off. I was panicking. Then we're all moving. I actually thought it was something, but it was just a drill. And someone was hiding, seeing how quickly everybody gets evacuated from that building. From that, they came to speak to us. Look, it looks like you are not aware of the evacuation channels, and my superior was queried that you brought in a new staff. You didn't really tell them where to pass in the event of an emergency, because I was not sure where to pass. I just saw people. I went one direction before going the other direction, and I went out late. You get it? So I'm looking at a law that puts all this in perspective. And I'm having some lawyers helping me. We are reviewing the various laws to see, do we amend an existing law, or do we develop an LI to a law? The National Ambulance Service Act is the latest law that has been passed in this space. They have some responsibility for pre-emergency care. The Public Health Act also has something on non-communicable diseases, but not really on the emergencies.
Right.
So we are looking at the emergency bit, whether a completely new law is what is required or some amendment to these existing laws. But we cannot wait till the laws before we act. The public education must go hand in hand. And we can use basic things like what we are doing now, like our movie industry. Just watch the average Ghanaian movie and see someone collapse and see the response. So when I think Winston was talking about people praying, that is what will happen in the movie. Pouring water on the person is what will happen in the movie. And someone will scream and run around for some minutes without even checking if the person lying down is responsive or not responsive. You are living with someone, the person is gone unconscious. First thing, call the person's name. Can the person respond? The person is not responding, then you assess. Can the person breathe? That's airway. Is the airway open? Is there circulation? Does the person have a pulse? You hardly will see a Ghanaian child attempting to feel for the pulse of someone, as if it's left for only medical personnel. But this is common knowledge that everybody should have. So I am hoping that public education, which we are doing now, will continue while we tackle the legislative framework. But the vanguard of all of this is the general public. If Professor Zakaria tells us what was expected of his people, to the extent that we do not know what we expect them to be able to do, so we hold them responsible for it, then it's not useful to us. So if remember, the National Ambulance Service was set up because of the May 9 disaster.
Yes.
Prior to May 9 disaster, we didn't have any ambulance service in this country.
That's true.
As an organized institution, where we lost so many lives. Unfortunately, it was anticipated that because of the setting up of this institution, any sports stadium disaster, which is what led to their establishment in the first place, should not lead to loss in lives. But what has happened? How many years down the line? It has failed us. And this is just one person being stabbed in a stadium, some minor route, and look at what has happened. So will that call for another review of their SOPs? Because this was what set them up. And a little test on it, and we failed.
Yeah. Ray.
There is this is a message from a lawyer. He says, once I get the legislation may be lacking in emergency healthcare, I do not believe that we can only move forward the law. Basic administrative decisions taken by the right persons within the health ministry could save lives. Do we need a law to say that first responders must be trained to a certain standard and have refresher courses periodically? We are so caught up on laws in this country. We can have all the laws and not comply with them. Can certain things not be incorporated into employment manuals with effective supervisory management to ensure standards are maintained?
There is a room for administrative arrangements, but it becomes enforceable if it's in law. And I think that we can go hand in hand. Like I've said, the education can go on, these administrative arrangements can go on, but we must also get that law that mandates, because for instance, it's compulsory to insure a public building now. Why can't it be compulsory that public building must also have these first aid arrangements? Why can't it be compulsory that we come to inspect, somebody can close an office because 50 people use it a day and you have no plan for them in the event of a first aid? So I perfectly agree with the lawyer. As I'm saying, some existing laws can work in some places, but we have to review that area.
I think I understand what you're saying. I suppose your lawyer's question is valid, but I want you to think about it. If I'm imagining where my son goes to school right now, God forbid, touch wood and all the necessary superstitions, if something were to happen to my son and I were to go to the school to find out why did you just watch him in that situation, and they were to tell me that, oh well, we are actually complying with the law, here is our first aid box, right, and here is our first aider, so we are actually not legally liable for what just happened to your son, I would be very upset.
But you would not be able to do anything.
Indeed. So there is a role for the law.
Yes.
But the practical end of it doesn't require laws.
No.
And let's get to the practical end of it. Dr. David Twum-Gyamra joins us, and he's a life support Ghana instructor. Dr. Twum-Gyamra, I wonder, have you seen the video of what happened at the stadium?
Yes.
Okay.
Yes,
bring some of your professional training to bear. What should have happened that might have saved this guy's life?
I want to start from where Professor Bayo ended. And yes, the law, a comprehensive legal framework will even empower the bystander as an effective first aid responder. Basically that, so that anybody who is around when there is an emergency is empowered to do something. I was in the United States recently, and we had a medical emergency. We called the emergency services. And then it wasn't an ambulance that showed up. It was a fire service truck. And they had everything to take care of the problem. Meaning that our service personnel are all mandated, because in the video I saw the police there who didn't know what to do, just walking about. So I don't want to put the blame on the Ghana ambulance service in this situation or alone, but I'll say that everybody is involved in this. Okay, so the first thing that they could have done was, yes, the guy was lying flat on the ground. So lifting up his legs, make sure that blood doesn't go downwards or blood is maintained around the heart. And then applying pressure to the wound. That would help keep the blood from coming out. Now, you said something about our movie industry and everything. If you ask, I went to give a training, and I asked people I was training, what is the emergency number in Ghana? Somebody said 911. And I'm like, no. Even our common, the thing that the simple number that we need to know at the tips of our tongue, it's not 911. No, a lot of people don't even know the number for the Ghana ambulance service. So in this situation with the video, it wasn't the best scenario. A lot of things went wrong, but empowering the bystander to be an effective first aider is very, very important. And then let me also mention that having an AED around doubles or even triples the chances of survival of anybody in a cardiac arrest situation.
Like you mean a defibrillator, right?
Introduction.
You mean a defibrillator, right? Just to use a term that's
automated external defibrillator, AED. Yes. So if we have this, which is enshrined in the law, that any place that, like what Prof said, any place that has a high number of people attending the place, they should have this number of AEDs. And Winston, you said something about the UK, their airport. Now, even UK has introduced up to class 5 years and above need to be trained in life support, basic life support, BLS. So if everybody is training this, especially the bystanders, which we at Life Support Ghana, we are trying to do and push this effort, knows this basic training, this situation wouldn't have arose. This situation wouldn't have arose at all.
Thank you for that. Let me bring in Kwame Sapon-Sedu. And Kwame, I use the example of the UK where you operate, and picking up from the last thing Dr. Chum Jamra shared, 5-year-olds are taught basic life support, which means that, in essence, at any given time, every British citizen or resident is within reach of someone who can save his or her life. At any given time, every single one of them is within reach of someone who can save their lives in a medical emergency. It didn't cost money to do that, just a bit of education. Should Ghana be looking at ways of ensuring, and I'd love your recommendations of what those ways should be, to ensure that the information becomes so widespread that my uncle in the village who is, not in school will still know what to do if his wife collapses, near him.
Okay, thanks, Kojo. You see, when I listen to Dr. Jamra and I listen to Titus, something makes me sad. If you remember, in my first comment, I did say that we could not criticize the ambulance crew unless we knew their terms of reference. Unfortunately, Dr. Zakaria has been here to expatiate further and give us an idea of what their terms of reference was. Because here's the scenario. If those ambulance crew had stayed in the ambulance and something had happened on the pitch, we'd be the same people to say that they didn't care when they came, they were more comfortable sitting in the ambulance. If they, because their primary responsibility, so to speak, devoid of there being this riot that happened, would be the safety of the people in the stadium, because someone can be injured on the pitch, someone can be injured in the stands and all that. So considering that the game had started, the likelihood of an emergency was higher in the theater, which is the field, than it was out of the theater. And that was why my first instinct was, I wouldn't make a criticism. So the first day, if Winston would tell, the first day we were having this conversation, I sent him a message on WhatsApp explaining that to him, that though I was sad, I wasn't surprised. And Kojo, I'll tell you why I wasn't surprised. And that is what I'll use to answer your question. We saw the last State of the Nation, and we saw how the president's ADC collapsed.
Yes.
And we saw the events. And there again, everything was wrong. But when you guys had a program and you called me to speak on it, you saw the number of people who were trying to defend from a partisan standpoint why what happened on the day happened. Some even trying to justify that the basic equipment I was thinking of, that at least there should have been a wheelchair or a stretcher, so that when he had been stabilized, because in that situation, fortunately, there were doctors around who have a good idea of emergency procedure and managed to stabilize him. But the evacuation left a lot to be desired. And when I said, my instinct told me that the evacuating equipment may have not been present, because if it was, it would have been used. And if you saw the videos as well, you saw the paramedics run into the chamber and they had no emergency kit on them. They ran in there. You can go back and watch the videos. We had this banter all over the country, including on your program on social media, only for another medic to come in as a new member of parliament to tell us there's actually nothing. But we didn't need Dr. Grace Ayensu and Professor Grace Ayensu Dankwa to say on the floor of parliament there was nothing. Just the optics of what happened on the day the ADC collapsed should have told us there was nothing. But as a country, because we are too partisan, we didn't even want to accept what we were seeing with our naked eyes. We didn't need Prof to go walk around to tell us that there was nothing available. The optics should have given us an instinctive feeling that there was nothing. But we argued the hell out of each other until an expert stood on the floor of parliament, which is a house of records, and made the statement that there was nothing and made suggestions. Now, coming back to what you were saying, as I came on the program, I was dropping my 7-year son in school. And when I gave finished my brief remarks, he's 7-year-old. He said, oh, next week he's refreshing his first aid. And I laughed. So, Kojo, what am I telling you? I was in my vehicle with my 7-year-old son, and if something happened to me, at least you have a fickle of an idea what to do for daddy. If you have watched videos on YouTube, you'd see mothers collapse with their 5-year-old children, and the 5-year-old children in the UK are able to call 999 and are able to tell the person at the call center, which Dr. Zakaria was describing, what is happening to their mom, and the person at the other end is able to tell the child what to do. Why? Because that child is trained. When we see those videos on YouTube, we're like, oh, this is a genius. It's not a genius. People have been very, very intentional in ensuring that that 5-year-old has knowledge that meets their assimilation and their dexterity to operate. The basics for a 5-year-old, that child knows. So like Dr. Bayo said, you'd hear the call handler go, is mommy breathing or is daddy breathing? They say yes. Can you feel a pulse? Yes. The kid can do these basic things. Meanwhile, someone who can take his own money to go and buy fufu, like Winston and was saying, and Sammy was confirming, doesn't know that. And when the man collapses, first thing is water, next thing is prayer. What if a muscle of fufu is stuck in the person's throat, and that is what is causing the obstruction, and the person is gulping for their dear life? Do they even understand how to put that person in recovery position and even open the airwaves? They don't. So, Kojo, it is not about the age. We are so illiterate when it comes to emergency pre-hospital care that we need to start being very, very intentional from our homes, from the workplace. It is only when we get intentional as a country and the information starts spreading that we can then think about the fine details. At what level do we put it? What would we do it for the SHS students first, then the university students, then workplaces and other things? Because look, we are so unintentional about these things that Kojo, look, we've seen head of states, former heads of states, vice presidents pass away, and we heard stories. We've seen statesmen pass away, and we've heard stories. We've seen, and you see, that is why when I hear questions being asked about what happened in Nsoatreman, I feel sad, Kojo. I feel sad because what happened in Nsoatreman happens every day in Ghana. To somebody who doesn't have a voice or who cannot speak. It happens every day. It will take professionals like Dr. Bayo and Co. to tell you how people arrive at hospitals and at accident and emergencies. Anyone who's seen an accident happen in Ghana where a car has crashed or even someone has fallen on a football pitch sees how the people are trained and how clueless we all are. So what happened in Nsoatreman? It is just because it was a football match. There were journalists around. It was between Kotoko and it was a Premier League game. We are highlighting it. Akojo, the sad truth is, it is a daily occurrence. In your introduction, you were giving some WHO statistics. Does that not tell you that it's a daily occurrence in our country?
Yep.
You are talking about, I've just come, I've gotten to the office, I've not gotten out of the car yet, and I'm talking to you. I haven't entered the building. I can see 4 AEDs in the car park at each entrance to my office. 4. Because by law, those exits are also emergency exits. So should an emergency happen, if that is the access route, then you see in health, we always talk about the situation X, and that's how I'd end it. The situation X, like when it comes to public health or in epidemiology, when COVID happened, it was a disease X. So when they are doing simulation, they are talking not just about the diseases they know, but the diseases they don't know. So that is the situation X. So when some people are planning for an emergency, it's not just the emergency they know that there will be a fire, but they also plan for a situation X, an unknown event. That is how intentional people are. So it doesn't happen to them where May 9th happens in Ghana and then we form an ambulance service. Someone would have thought about that as a situation X. So if Kojo, you lived in the UK, you've heard and read about the Hillsborough disaster.
Yeah.
When it happened, that was one of the reasons why people were held culpable. Because even though it was a situation X that hadn't happened again, it was something that had been simulated just in case it happens. So when it happened and the system collapsed, then there was culpability. In our situation, we do not even know our situation X is. And when the situation X happens and gives us an opportunity to learn, we do not learn from it. So if you ask me that question, that where do we start? What can we do? That's why I agree with Prof. Bayo that we need to get the legislation in place, because left to our devices, we are not a society who has been shown to be intentional even with the implementation of our laws. So how do you tell a country like that to be intentional without a framework? It's not going to happen, Kojo.
We have to.
So I can understand the lawyer. Yeah, I can understand the lawyer, but if we don't get the law right and we don't get intentional, Kojo, it's not going to happen.
Indeed. Look, one thing is clear. We have to continue this conversation. For one, we lost Prof. Zakaria. We have to get him back into the studio. We're working on getting him here tomorrow. But I have to ask Prof. Bayo, Dr. forgive me, Dr. Chum Jamra, Kwame Sapwansedu. I have to ask you all to help us reconvene and continue this. This is a life and death matter. You know what I've realized? By the way, thank you to all of you. What I've realized is this: as a country, as a society, we do not seem to possess a collective instinct for the preservation of life. and it shows in everything we do.
Yeah.
We prioritize everything over the instinct to preserve life, which is a sign of a mental imbalance. A human being that does not have the instinct to preserve his life, you have a mental problem. And there's evidence of this, especially in how we prioritize politics over the preservation of life.
We prioritize death.
Listen, I'll leave
We
you with this.
prioritize death
Indeed,
over life.
over life. I'll give you this instance, and then we'll go for a break. Not so long ago, maybe 2 decades ago, we had an institution in this country called the Red Cross. The Red Cross used to go to hotels, schools, to restaurants, to event centers, to lorry stations, to communities, even to homes,
Even schools, they have
yes,
clubs.
schools, to educate people on first aid. We decided to replace the work of the Red Cross with an organization called NADMU, where we would just use it as an avenue to load cronies and foot soldiers into employment. How much first aid training has NADMU given to Ghanaians? I'll leave that with you. We'll take some messages. We'll be back after